Hello everyone. Now we are going to discuss about open vial policy. I am Dr. Anusha, Assistant Professor in the Department of Community Medicine. What is open vial policy? Open vial policy is a policy which we will follow for partially used multi-dose vials. So during vaccination sessions, we will come across single dose vials and multiple dose vials. Single dose vials means in that vial only that is enough to vaccinate only one child. But multi-dose vials means so in that vial some 10 doses, 20 doses, 50 doses vials will be there depending upon the vaccine manufacturer and brand. So those multi-dose vials, when they are partially used, what do we do with them? So should we discard it or should we use it? So that will be told by this open vial policy. So the vaccines which are following open vial policy and we are following strict cold chain conditions to store those partially utilized multi-dose vials, then they can be stored up to, they can be reused up to 28 days or 4 weeks. So because of this open vial policy, wastage of vaccines are decreasing and it is maximizing the utilization. And this open vial policy is proven to reduce the vaccine wastage up to 40 to 50%. Definition of open vial policy is reuse of certain multi-dose vials in subsequent immunization sessions for up to 28 days after opening, provided specific conditions are met. So once the multi-dose vials are opened and it follows specified conditions, then we can use up to 28 days as we discussed in the previous slide. And what conditions to be followed for us to reuse them? So the multi-dose vial expiry date should not be crossed. That is one criteria. And these partially utilized vaccine should be stored in cold chain continuously. That is plus 2 to 8 degrees centigrade. That means after the vaccination session is complete. So from that outreach session till the health center, and in the health center it should be stored in cold chain, and from that health center again for the next outreach session till the vaccination site. So throughout this phase they should be stored continuously in the cold chain. This is another condition. And one more thing is the vaccine vial monitor should be valid. And next is the septum of the multi-dose vial. Septum means where the cap is there, from where we will draw that vaccine. So that septum should not be submerged in water. If it is submerged in water means there is a chance of contamination. So the septum should not be submerged in water. And on the septum the date of opening should be written. And aseptic technique should be followed while withdrawing the doses. When we are drawing the vaccine for vaccination session, we should follow aseptic technique. Then there will be no chance of contamination. And another is no evidence of contamination. So if for these partially opened vials, if they are following all these criteria, then we can tell that it is following open vial policy, and we can use up to 28 days for the next vaccination sessions. And if any one of the above conditions are not met, then the vial should be discarded. And only certain vaccines will follow open vial policy, like oral polio vaccine, inactivated polio vaccine, pentavalent vaccine, hepatitis B, TT or TD. Only these vaccines will be covered under open vial policy. And certain vaccines like BCG, MR, JE vaccine and rotavirus vaccine. So these vaccines are not covered under open vial policy. That means once opened, they should be discarded after the specific time, which is 4 to 6 hours, and they cannot be used till 4 weeks, even though we are maintaining the cold chain. So the rule is reconstituted vaccine must be discarded within 4 to 6 hours of reconstitution. Um, for these vaccines, BCG, measles, JE, then rota. And so all these vaccines, even though they are following open vial policy or not following open vial policy, um, uh, If those vaccines are completed, then we should discard with after 48 hours or before starting the next vaccination session. Why we should store the completed vials also means after the immunization session, if any one of the child is developing adverse events following immunization, then the vial should be sent for investigation of AEFI. So for that, those vials should be stored till 48 hours or till next vaccination session, which is the earlier. And what are the benefits of open vial policy? It will reduce the vaccine wastage and it will improve the cost effectiveness. So, in the government, the budget is limited and we want to cover more children. So, we should follow cost effective measures and it will enhance the vaccine availability. If wastage is less, then availability will be more. And it supports uninterrupted immunization services. So we should remember that reconstituted vaccines, which are freeze dried or which are coming in powder form, and we are reconstituting with normal saline or another thing. So these reconstituted vaccines should never be used in subsequent sessions because chance of contamination will be there. So this slide is also showing the same. These are the vaccines which are following open vial policy: DPT, TTTD, hepatitis B, OPV, pentavalent, pneumococcal conjugate vaccine, and IPV. And the vaccines which are not following open vial policy: MR, BCG, JE, rotavirus.